My name is Michael Leeds. I'm a psychotherapist. I live in Eugene, Oregon. I'm a master trainer for the National Institute on Drug Abuse, and I've been a licensed clinician for 35 years. This afternoon I'd like to introduce a little bit of a relapse aid, a little bit of a technique that will help people to relax, help them reduce unwanted thoughts, and maybe even reduce some physical experiences. It's based on a notion of hypnosis. And years ago when I was being trained as a clinical hypnotherapist, one of the consistent themes about hypnosis in general was the dependency upon the therapist. In other words, you needed a tape or an individual to affect the induction, and that created a dependency state between the inducer and the inducee. So this particular model is a self-induction. Although all hypnosis in general has often been considered to be self-hypnosis, this one is acutely so. It's actually very, very much self-induced. It's got a little bit of science to it that we may or may not interest you, but the experience is the most important thing. That's the proof of the pudding. It's not really in the theory, it's more in how it works for you. So if you want to follow along on this is an eye-open activity. You don't have to close your eyes, that's important depending on where you live in the country. So it's an eye-open activity. You can do it standing. I wouldn't recommend that, but you could do it standing. I wouldn't recommend you doing this while you're driving because that would compromise you and other people. I'm sure that would be too dangerous. But seated, lying down, in the comfort of your home or office space, anywhere where you can get 5, 6, 7, 8 minutes on uninterrupted time, I think would be a good application for this particular strategy. This strategy comes from Milton Erickson's wife, whose name is Betty, I was told. So in my practice, I refer to this as the Betty, although that might not be the best thing for it, but it seemed to be the most honorable decision on my part. Milton Erickson, as you know, is a very, very, very prominent and successful hypnotherapist. One has guided our thinking in this particular activity for many years. So, the Betty was designed by Dr. Erickson's wife as a way of inducing a very light trance without having to create a dependency on another individual. So what I'm going to ask you to do is, in your chair right there, kind of put your feet flat on the ground and relax yourself a little bit. You don't have to do anything radical, frankly. And what I'm going to ask you to do for just a moment is to identify 3 different things that you see in your visual field. Identify 3 different things. You don't have to tell me about them. I couldn't hear you anyway, but identify 3 things that you see in your visual field. And then I'd like you to shift your attention to 3 things that you hear. And then shift your attention once again to 3 things that you're feeling, and the feeling can be either internal or external. Stomach gurgling, or you can feel the chair against the bottom of your body. And then shift your attention again and identify 2 different things that you see. And identify 2 things that you hear. And 2 things that you feel either internally or externally. Once again, shift your attention back to your visual field. Identify 1 thing that you can see. Identify another thing that you feel. And finally, identify 1 thing that you hear. And just hold on to that experience. For many of you, for some of you, what you might have experienced is a very, very subtle shift in states of consciousness. It's a very light induction. And what that helps us to remember is that states of consciousness are available, accessible, and they're shifting. And for those of you who are in stages of recovery, who are being plagued by intrusive thoughts, or being plagued by intrusive cravings or urges, this simple technique that Betty takes a couple of seconds to do might actually affect a very, very, very subtle yet dramatic shift in consciousness for you, give you an opportunity to make another kind of a choice, an opportunity to consider another thing to do next, other than to relapse, use, or compromise your recovery.